Hello, my name is Matt Pearce and I'm the Head of Public Health and Wellbeing at West Berkshire Council. I wanted to spend a few minutes just talking about our new local outbreak control plan, what this means for our communities, residents and wider partners. Firstly, it's important to think back to January, when we know there was a rapid spread of COVID-19 across the UK. This led to the government introducing social distancing measures and national restrictions, also known as lockdown. From the middle of June, the government have started to ease these restrictions. However, social distancing continues. We know that the level and rate of infection across the country will likely move at different rates, and therefore a more localised approach is needed that requires a local response and appropriate actions. So why do we need an outbreak control plan? Local authorities have been asked by the Department of Health and Social Care to produce a local outbreak control plan by the end of June. And the reason for this is that we want to keep our residents as safe as we can from COVID-19 until better treatments and/or vaccine is available. And this may be some time off yet. We want to build on the local knowledge and trusted partnerships. We know that local authorities are well placed to coordinate our response to local outbreaks and incidents. Our local outbreak control plan links into the National Test and Trace Service. The purpose of the plan is to set out how we will control the virus and protect public health and minimise further spread across the district. So what do we know about West Berkshire? It has a resident population of about 160,000 and a mixture of urban and rural areas. Our residents generally live long, healthy lives and have good quality of life. Levels of deprivation are quite low. However, there are significant health inequalities, and these are likely to be more susceptible for being exposed to the virus. West Berkshire Council is part of something called the Berkshire West Integrated Care Partnership, and this consists of NHS health partners, local authorities, and the voluntary and community sector. The government have asked us to cover a number of key themes within our plan. This includes care homes and schools, preventing and managing outbreaks in specific individual settings. It also talks about high-risk places, locations and communities, so how we can prevent and manage outbreaks in other settings, such as workplaces, housing. Also, local testing capacity. We need to ensure that people have access to testing when they need it. Fourth, contact tracing in complex settings. So we need to identify those individuals who may have come into contact with somebody who tested positive and advise them on how they need to self-isolate and what action they need to take. The fifth theme is about data integration. We need to ensure we keep an eye on the data, we understand how many people are being tested so that we can identify where there might be local flare-ups or where local outbreaks might be occurring. This also includes receiving local intelligence from people in the community. Sixth, we need to support the vulnerable people and ensure our services meet the diverse needs of our communities. Seventh, we have quite a complicated but comprehensive governance structure in place, and that provides strong oversight of communication and engagement. And then finally, we need to keep our workforce safe. So how do we manage our risks locally going forward? Well, we know that COVID-19 is transmitted largely in droplets, coughed out by people who are infected. And we know by far the most effective measures to prevent spread is from keeping distance from others, using tissues to catch our coughs and sneezes and disposing of them safely, washing our hands frequently, and then isolating those who are infectious. However, what we do know from the data is that some people seem to be more likely to catch COVID-19 or become sick as a result. These people need extra protection and include older people, people with long-term conditions, and Black, Asian, and minority ethnic individuals. Some settings are also more risky. This could be where infectious people are being cared for, or where social distancing and isolation can be more difficult, and where there are people at particular risk of harm from COVID-19. In West Berkshire, we're developing a range of focused outbreak plans for different settings across the district. The focus of these plans is both on preventing outbreaks from occurring in the first place, but making sure we have strong, robust plans and processes should an outbreak occur. These settings are nurseries, schools, workplaces and retail, care homes, colleges, NHS health, leisure, faith settings, and vulnerable groups. So what happens if there is an outbreak? Firstly, we are supported by Thames Valley Public Health England team, who support the NHS National Test and Trace Service. If they identify somebody from a complex or high-risk setting, we will work with Public Health England to ensure we wrap around some support, bringing in the relevant partners to understand the issues, undertake risk assessments, and then put in place the required actions as needed. So what will this look like? We will be watching data on cases and risks closely, so we will spot outbreaks early. We will support our residents to stay safe, encouraging hand washing, social distancing, and isolation, and assisting those who need help to comply. Importantly, we need to act swiftly to put local actions in place and support Public Health England's recommendations on controlling spread. We will also support individuals in high-risk settings, and we will also communicate with local people and organisations to help them keep safe. The actions we take will largely be dependent on the risks that we identified and the specific circumstances and the context. These will always be effective and based on the best available evidence. So what will these actions look like? This could be from alert messaging, informing our communities about whether the rate of infection is low, medium or high. We will ensure focused testing to make sure those who need test it, get it. We will also deploy testing if needed. So if there is an outbreak in a particular setting, we will look to ensure testing is available and support those, even if they may be asymptomatic. We may also look at closure of premises or high-risk settings in other facilities. The environmental health officers within West Berkshire Council already hold these powers, and it's likely that most of the action will take place at this level. We may restrict visiting. This has already occurred in care homes, for example. Or we may do more enhanced contact tracing. We will also look to support the most vulnerable. We have a well-established community support hub in West Berkshire, which is connected to over 90 voluntary and community sector groups. We may look to cancel some events, closing playgrounds or other outdoor spaces. We might ensure there's enhanced monitoring of people isolating to make sure they comply with national guidance. And finally, we want to provide specific advice on personal protective equipment where needed to ensure infection prevention and control measures. A fundamental part of our plan is being open, honest and transparent and communicating with the public so they are kept informed about what is going on. We will ensure that the local voice is heard through our active engagement with local communities, and we have effective communications in place. In light of this, we have a new local outbreak engagement board, which will be held regularly, led by local councillors accountable to the public. This directly feeds into West Berkshire's Health and Wellbeing Board that is made up of a range of partners. We will keep our website up to date with the latest information and guidance, ensuring that you can access credible information that is evidence-based. And at this point, I'd like to remind you if you could sign up to the Council's e-bulletin to ensure you receive the latest information. We will also use social media to spread the word, particularly targeting those communities that are hard to reach. We will also work with services, businesses and organisations to make sure information is clear and accurate. And then finally, we will make information available in accessible formats and languages other than English, recognising that there are a range of vulnerable groups that are more likely to catch and have complications from COVID-19. In terms of the governance, it's important that we have a strong, robust governance framework in place. And we know that COVID-19 outbreaks will likely extend across local authorities' boundaries. Therefore, we will be working closely with both Reading Borough Council and Wokingham District Council. And the overall plan will be seen by Berkshire West Health Protection Board. Berkshire West involves Wokingham, Reading and our NHS partners. and together we will look to control the spread locally. This will be supported by the West Berkshire Outbreak Engagement Board and West Berkshire Gold Command, that will look to deploy resources as required. At a more strategic level, there's a Thames Valley Local Resilience Forum, and again, this will provide support if outbreaks occur at a larger geographical area. So there are a range of different ways for the public to get into contact depending on the circumstances and the situation. If you are self-isolating or vulnerable and need help with shopping or medication delivery, then you can still contact the Community Support Hub. If you think someone has COVID-19 in your particular workplace, school or other setting, then you can contact our duty desk. If you have COVID-19 symptoms, it's important you stay at home and contact the NHS or ring 111. And finally, please do keep up to date about the national guidance on the .gov.uk website.